Kidneys care, cleanse, detox, and regenerate. Suggested food, dietary supplements, and great tips for your kidney and urinary system. Consider taking them as per your specific condition, peculiar signs, and symptoms, as suggestions vary from person to person. Make sure to avoid any ingredient or food you are allergic or intolerant to discussed in this video. Read the disclaimer, and if you are interested in such health-related informative content, please make sure to subscribe, like, share, and press the bell icon. Good diet for kidneys detox and cleanse. Apple cider vinegar can help prevent the growth of infection, causing bacteria, and flushes out toxins from kidneys. Contains citric acid, may dissolve kidney stones. Dilute ACV in a glass of water and honey and consume. Kidney beans help remove waste and toxins and flush out kidney stones effectively. They are rich in B vitamins, fiber, and several minerals which help to clean the kidney and boost function of the urinary tract. Pomegranate, both the juice and seeds, contain large amounts of potassium and are effective in removing kidney stones. Potassium lowers acidity of urine, prevents stone formation, curtails crystallization of minerals, and flushes out toxins and waste from the kidneys. Avoid potassium supplement or rich foods in renal failure patients. Basil is an effective diuretic, a natural painkiller and useful in urinary infections. It removes kidney stones, uric acid, and improves kidney functioning. Dates are effective in dissolving and flushing out kidney stones and help to reduce the risk of kidney stones. The fiber and magnesium ingredient in dates cleanses the kidneys. Coconut and barley water's a well-known remedy for many problems affecting the urinary tract with mild diuretic properties, promoting urinary output. Carrot juice can help control urinary retention. Effective in urinary infections and can help relieve the burning sensation while you empty your bladder. Probiotics, friendly bacteria, have shown some promise for preventing bladder infections and help to keep harmful bacteria in check, reducing the risk of urogenital infections and their recurrence. Yogurt, fermented cheese, kefir, kimchi, etc. are effective in dealing with the problem of urethral stricture naturally. Unsweetened cranberry juice with antioxidant, mild antibacterial, and anti-inflammatory properties is the most effective way to prevent infections of the urinary tract, reduce excessive calcium oxalate, help cure urethral stricture, and to remove toxins. By rebalancing urinary pH levels. Beetroot juice with antioxidant and anti-cancer properties. Amplify the tartness of urine. Beets may increase urine acidity, prevents buildup of struvite crystals, and calcium phosphate plus reduces the chances of kidney stones formation. Watermelon juice, great help for melting kidney stones, etc. It is a mild diuretic, hydrates and cleanses the kidneys. It also has large quantities of potassium salts which regulate acidity of urine and prevent stone formation. Lemon juice, mixed with hot water and olive oil, can help aid in smooth passage of kidney stones and discourage further formation of kidney calculus. Increasing your water intake is the most fundamental step in the treatment of UTIs. Higher fluid intake will result in more urine production, making it easier to expel the infection, causing bacteria, hinder the stone formation, as dehydration can lead to kidney stones. Drink sufficient, but not too much, water. If you're prone to renal failure or urinary incontinence. Raw garlic has a variety of antimicrobial activities against a wide range of pathogens involved in UTI. It also has antifungal properties, particularly against candida, which causes yeast infections. Cardamom acts as a diuretic, helping flush out toxins and retained water. Mix 1 teaspoon of cardamom powder in a cup of warm milk or green tea with some raw honey and drink before bedtime. Parsley tea with a mild diuretic effect may help flush UTI-causing bacteria out of the urinary tract. Consume flaxseed oil, as it may protect kidney from further progression to renal failure and slow the process of further renal damage. Drink orange or other citrus fruit juices like grapefruit are commonly used to prevent kidney stones. Increase intake of fibers such as berries, apples, pears, figs, artichokes, chia seeds, whole grains, sprouted grains, cabbage, oats, green leafy raw vegetables, peas, sweet potatoes, salads, dried or fresh fruits, broccoli, green tea, cocoa, and sea vegetables to keep your kidneys healthy and prevent from stones formation. If possible, stick to plant-based diet. Diet high in animal protein or saturated fats affect certain minerals in the urine which aids in the formation of kidney stones, if you are not on dialysis and your blood urea and nitrogen is increasing. Excessive use of animal proteins may cause tubular damage to the kidneys, as the kidneys will have to filter more of the proteins. Things to avoid for healthier kidneys. Avoid processed foods such as white bread, refined grains like cereals, breads, wraps, cookies, and cakes. Processed foods such as hot dogs, French fries, red meats can cause body to excrete calcium, leading to a buildup of calcium in the kidneys. Foods with excess chocolate and artificial sweeteners can cause inflammation of the urethra, urethral stricture worse, and increase bladder discomfort, leading to urinary retention. Acidic or spicy foods. These foods often cause bladder irritation. Acidic foods include citrus fruit and juices, vinegar, and tomatoes. Spicy foods include hot peppers, curry, chili sauce and powder, barbecue sauce, and horseradish. Avoid bladder irritants, such as caffeine, alcohol, and sour foods, animal proteins like red meat, egg, fish, chicken, as they make the urine more acidic, especially people who have tendency of uric acid. Avoid having carbonated and caffeinated drinks. Such foods are dehydrating, which can make kidney stones worse. Also, they can irritate the walls of the urethra and result in strictures. They can worsen an overactive bladder and contribute to bladder irritation. Alcohol is a diuretic that causes to produce more urine, which can contribute to urge incontinence. Foods high in calcium oxalic acid, spinach, rhubarb, nuts, wheat bran, tomatoes, collards, eggplant, celery, summer squash, and peanuts may cause kidney stones. To prevent edema, kidney stones formation, or patients on dialysis, sodium or table salt levels must be low. Cut down on packaged and canned foods, pizza, chips, crackers, condiments, dressings, sauces, and other heavy junk foods. Avoid sweetened drinks including lemonade, most commercial juices, and soda, especially one that contains phosphoric acid. Common allergens, e.g. conventional dairy products, mayonnaise, grains containing gluten, peanuts, and shellfish. Quit smoking. Heavy smokers are at greater risk of developing an overactive bladder. Taking large amounts of turmeric/ginger may lead to kidney damage, so best to avoid. And finally, avoid large amounts of over-the-counter pain or heartburn medications like antacids, which contain calcium. Supplements for kidney health. If you have a kidney disease, reduce intake of vitamins A, E, and K, especially calcium, phosphorus, and sodium. Taking magnesium supplement can help treat incontinence and may reduce kidney stone risk. Vitamin D is used to control urinary incontinence because it helps maintain muscle strength. Eat more foods rich in vitamin D, such as fish, oysters, egg yolks, and fortified milk, etc. Vitamin C in small amount can reduce incidence of bladder infections, help avoid crystallization of uric acid, and helps in urinary excretion of uric acid. It also helps to increase immunity and combat the infection. Zinc supplements can help improve immunity against bladder infections. Niacin vitamin B3 can help to balance phosphorus, which is important for kidney health. According to few reports, vitamin B1, B6, and vitamin E may reduce calcium oxalate levels. Additional tips for kidneys health. Maintain a consistent schedule of urinating every 2 to 4 hours, even if you do not feel like going. Practice pelvic floor or Kegel exercises for urinary incontinence. Be careful to avoid any injury to the urethra or pelvis. It is one of the most common causes of urethral stricture. Heating pad can help in relieving UTI pain. Also helps reduce bladder pressure and ease passage for urine. Avoid holding urine for long and attend the call of nature without delay. Practice toilet hygiene. Clean and dry genitals after passing urine, stool. Taking showers instead of baths and avoiding bath oils. Use cotton undergarments and loose-fitting clothes to allow air to circulate freely. Thanks for watching. Always seek medical help and advice from your GP or health provider. Or you may contact our holistic health clinic in Birmingham, UK for more specific, tailor-made complementary remedies as per your peculiar signs, symptoms, and causative factors. Consider remedies for long-term wellness with extra safety margin. Finally, avoid self-medications even with natural or herbal medicines. Bye for now, and speak to you soon in another video.